A lot of docs don't want to take Medicaid patients because the reimbursement rates are so low. They would rather turn up at an emergency room at a hospital. 17 million of these people are people earning over $50,000 a year. 2/3 of them are between 18 and 31. The young invincibles. I used to be one. Why would I need health insurance? Nothing's going to happen to me. But these people would buy insurance, these young people, if they could buy insurance for what insurance is, to cover catastrophes. But with all of the mandates that are placed on insurance companies, it becomes very difficult to get a high deductible insurance plan. Following passage of the two bills, the next step really was for, remember, the conference committee. And Obama said when he was campaigning that the negotiations would appear on C-SPAN. Well, transparency went out the window, and they decided to use the ping-pong approach. And that has been going on, and that's what's going on right now. Whether Nancy Pelosi will be able to get the House to pass the Senate bill, whether they can do $300 billion more in fixes, I don't know. But I do think the President is so committed to healthcare reform. He really thinks it would be a disaster if after a year of working on it. Can you imagine if I worked on a project for a year and it all fell apart? I'd be pretty, upset with myself too, but he is definitely committed. So, yeah. If this healthcare plan does pass and signed by the President by the end of this year, as I said before, it's going to be very costly. It'll cost us, the taxpayers, probably over $2 trillion. And it will take us down the path because costs will not be controlled, care will have to be rationed, and we will be on our way to that Canadian-style, single-payer healthcare system. Polling data and outreach by the American public make it clear we don't want higher taxes, we don't want higher deficits, and we certainly don't want rationed healthcare. The Democrats and the President are not listening to the American voters. I think they have a vision. I think President Obama, Pelosi, and Reid have a vision. It's not just about health care. They really want government to manage our lives rather than ourselves managing our own lives. If this passes, this will be the largest entitlement program in America since the Great Society. So I'll finish up by looking at some solutions. As I said, I believe in patient-centered solutions, empowering patients and doctors. The President keeps telling us that the GOP has no solutions. The GOP does have solutions, but they need to unite around a single plan and push it forward. The problem is the Democrats are not listening to good ideas. A friend of mine had a meeting at the White House and took my book, The Top 10 Myths, and tried to slip it into Obama's hands, and actually got it into his hands before being pulled out of the meeting. So I guess he probably hasn't read it, but he did get a copy. Solution number one, empower doctors and patients. Let's get rid of the third-party payer system and put people back in charge. Our current system, employer-based system, 64% of Americans get their health care through their employer. If you lose your job or you quit your job, your insurance is not portable. We need to make health insurance portable. We got into this mess, of course, because of the federal government. During World War II, when wage and price controls were in, employers were having a hard time attracting new workers. And so they gave the feds gave employers the ability to write off the cost of health care, and employees got their health care tax-free. But what happens if you lose your job, you go out into the individual market, you have to buy your insurance with after-tax dollars. And if you have a pre-existing condition, it's pretty difficult to get insurance. I forgot to mention, out of that 46.3 million Americans without health insurance, only 8 million of them are people who are chronically ill without health insurance for 2 years or more. Those are the people that we need to take care of. I would like to suggest that if the government wants to do something, they should change the tax code so that individuals can get their insurance with pre-tax dollars the same way that those people today get their employer-based coverage. Ultimately, we will see more and more people move into the individual market. We will develop a competitive market, and your health insurance won't be tied to your job. After all, we don't get our long-term care insurance. We don't get our life insurance from our employer. Why should we be getting our health insurance through our employer? So that is solution number one. And Mitch McConnell, fortunately, on the TV shows on Sunday, actually started talking about the tax code changes because no one else had. Then second, I think if the feds want to do something, what they should do is increase funding to the various states to have better funding for the high-risk pools. 35 states now have high-risk pools, but a lot of them are topped out, and so people can't join them. So I think, A, they need to beef up the funding, and the 15 states that don't have high-risk pools, they should set them up so that those people who are uninsured can get insurance in that exchange until we get a market going. And then there will be a lot of new insurance companies. Some will focus on people who have chronic disease. You know, there will be, people can join, just like when Bush was president, he talked about association health plans so that people could group together, you know, whether it's with their church or their car society or whatever, and then they would be able to have a bigger pool, which reduces costs. Third, we need medical malpractice reform. The president said during that September 9th speech, well, I am willing to look at a couple of demonstration projects in states about med mal reform. He said, I've decided to put Kathleen Sebelius, Secretary of HHS, in charge of those projects. Well, before becoming Secretary of HHS, Kathleen Sebelius was governor of Kansas, and before that, she was president of the trial lawyers of Kansas. So to me, that's putting the fox in charge of the chicken coop. But PricewaterhouseCoopers has estimated that the annual cost of docs practicing defensive medicine is $210 billion a year. In Texas, in 2003, they did med mal reform. 16,000 new docs have come into the state of Texas. Punitive non-economic damages are capped at $250,000 and punitive at $500,000. Doctors' medical malpractice insurance rates have gone down, and also insurance rates for people in general. Doctors practice defensive medicine because they are afraid of being sued, and a lot of OBGYNs and neurosurgeons got out of the practice of medicine because the cost of their insurance is so high, $150,000 to $200,000 a year. So med mal reform is a very important part of the solutions. We need to make insurance portable, owned by individuals, because in that case, people will move to individual insurance, and as I said, new companies will come into the insurance market, just like in any other aspect of our life, whether it's your Visa card, your telephone service. Competition reduces price and brings many new entrants. People should be able to buy insurance across state lines. Yes. If you live in New York State or New Jersey, they have the most expensive health insurance in the country. Why? They have 46 mandates on insurance companies, plus guaranteed issue and community rating. The president keeps talking about guaranteed issue and community rating going along, which would have to be combined with an individual mandate. Guaranteed issue means that an insurance company cannot discriminate based on one's medical history. Community rating means you cannot charge a different price based on someone's medical history, sex, or age. As a result of those two mandates in New York and New Jersey, they have the most expensive insurance in the country. Young people do not buy insurance because if you're a young man and you're 30 or 29, you don't want to spend $500 to $1,000 a month on a health insurance plan that you're never going to use. If you are that person, maybe you can find it in Arizona or in Idaho. But right now, you can't do that, so it discriminates against people. We need to expand the health savings accounts, which were one of the key, I think, great things that President Bush did. We need to reduce regulations on health savings accounts. We have about 9 million Americans